Well, in Connecticut, Governor Ned Lamont has been holding daily press conferences ever since the onset of the coronavirus pandemic. Yesterday was his last, at least for now. And Governor Lamont is joining us right now as we are seeing another phase in this pandemic, what seems like a better phase. At the same time, you guys, if you look at the vaccination rate in Connecticut, I believe you're around 62, 63%, Governor. What are you going to do to get that number even higher?
Hey, good morning, Julie. We've got 75% of our adults have been vaccinated. Obviously, the younger folks, many of them aren't even eligible to be vaccinated. If you want to come to Connecticut, it's the final weekend of Drinks on Us, which says if you can show you've been vaccinated, the first drink is on you.
And so you're doing a bunch of different incentives, I guess, for people to get their vaccinations. Are there any populations that you feel like are still particularly reluctant that might need other more creative solutions?
I do. I worry about part of eastern Connecticut, a little more rural. They've been less likely to be vaccinated. Some of our urban populations, we got to continue to do a better job of having trusted advocates there. We're bringing vaccines right to the home. It's a home delivery, doing everything we can to get that number up from 75 to 85%.
So, Governor, as we see vaccines roll out, I'd love if you could just, update us on where Connecticut is at in its reopening, if there are restrictions still in place, and how you expect that to change, if at all, through the summer.
Yeah, we started reopening, as you know, a little over a year ago for outdoor dining. At this point, as of the last month or so, everything is open, no mask required unless you haven't been vaccinated. If you have not been vaccinated, you must wear the mask indoors.
And Governor, of course, as we have seen sort of along the same track as the push to reopen, to get folks vaccinated, there's also a push to get people back to work, right? And we have seen a lot of states now take off the supplemental unemployment insurance. Connecticut has not done that, but you guys are offering a bonus for people to go back to work. How exactly does that work, and why did you decide to go that way?
We're offering a $1,000 bonus for the first 10,000 people that sign up. Those who have been long-term unemployed, they got to keep the job for a couple of months, and people are signing up. We've had, thousands of people go to our website asking about this, so I think it's important. Look, Julie, a lot of folks, we got hit hard by COVID back, a little over a year ago. Part of that New York metro hit, and we've got a lot of folks who are very COVID hesitant. And anything I could do to nudge them forward, if a little extra support to pay for childcare, transportation, let's do it. Because our restaurants, our service sector, they need the people.
And, Governor, when we spoke, as we've spoken over the last year or so, certainly the state of the budget, the deficit for your state and many others has changed over time. As you look at, where the state's finances are today versus where they were a year ago, is the state of Connecticut in a better fiscal position as you look to plan for the next couple of years as we hope to see the economy continue growing?
Yeah, we're in a better shape than we were a year ago, a better shape than we've been in the last 10 years. The rating agencies have given us an upgrade or two over the last 6 months. That means a lot. We got $3 billion in our rainy day fund, so we're ready to weather whatever storms may be around the corner. And we're able to make the investments, in part thanks to the rescue plan coming out of Washington, D.C., real investments in jobs and opportunity and free community college, trying to get everybody back in the game and working.
And Governor, what role, if any, does sports gambling play in all of this as well in terms of bringing in revenue for your coffers?
Yeah, as you know, we've got two great tribal partners, Foxwoods and Mohegan. They got gaming going back in the 90s. Now we have to bring it into the 21st century. That includes virtual or iGaming. So we signed that bill yesterday, that plus sports betting. The state will be the house through our own iLottery and working also in conjunction with the tribes. I was just joking listening to your commentary on GameStop. There are other types of betting going on right now, but now we're also going to have casino games.
Governor, you're a friend of the program. We've talked to you throughout the pandemic. You watch the market. Are you surprised by some of these moves in these meme stocks? I thought, we wouldn't be seeing moves like this as economies like yours open.
The economy is very strong. So look at the fundamentals, first of all, and there's a lot of pent-up demand. Our restaurants are filling up. Our beaches are filling up. Tourism is coming back. I don't think it's unique to Connecticut. I think you're seeing this in other parts of the country as well. People are ready to go. It's been a long lockdown, a long period of quarantine, and I think you're going to see that reflected in the economy. Our manufacturing is going very strong. Construction is booming, especially housing. I mean, we've had 50,000 plus people move to the state of Connecticut in the last 6 months, and you're seeing that reflected in housing starts.
Yes, indeed. We've been seeing that in a lot of the big housing numbers. Governor, it's always great to see you. Be well, and let us hope, fingers crossed, that you will not be having to resume those press conferences on COVID. Hopefully ever, but we'll see how the trajectory goes. Governor Ned Lamont of Connecticut, appreciate it.
Thanks, Julie. Take care, everybody.
HP shares are under pressure this morning, despite the computer and printer maker smashing analyst profit estimates last night. The company continued to experience strong demand for notebook computers while also seeing a rebound in its office printer business. Now, I talked with HP's president and CEO, Enrique Lores, about the quarter and outlook.
So first of all, thank you, Brian, for having me here. It's always great to see you. As you said, we had an exceptional quarter, double-digit growth, both in top line, in revenue, significantly above market expectations. We also increased guide for the rest of the year. So I don't think this was a surprise. I think we just executed and did what we said we were going to do. And I'm really pleased with the progress we have made this quarter.
Well, I'll tell you what surprised me. It was the commercial printing side of the business. The units up 22%. In the first quarter, when we talked, units were down 6%. So why the comeback?
Well, we were expecting the office business overall to start recovering as people would be going back to the office and offices would be reopening. And we are starting to see some of it. We still think it will be stronger at the end of the year, but this is what is behind this recovery you're seeing.
What are you hearing from those enterprise customers? What are they buying? Are they upgrading their entire office? Are they buying new office supplies for printers? What are they doing?
What they are really doing is trying to improve the experience for their employees because they want them to go back to the office. And therefore, they have realized that they need to invest again in the equipment that employees will be using in the office, whether it's printers, whether it's PCs. They really have a big need to do that. And this is what we are seeing, which is also driving the acceleration of the demand that we are starting to see on the commercial side of PCs.
Within the consumer side of the business, in the personal systems segment, you aren't hurt by the chip shortage? I mean, those sales were up 72%.
We, both in consumer PCs and commercial and consumer printers, we are up more than 70%. And I would say that the issue that we are seeing in components is an industry-wide problem. And if I had to choose, I always prefer to have an issue like that, which is driven by how strong the demand for our products is. What we are demonstrating both with the strong results we had this quarter, but also with the increase on guide, is that we know how to manage this situation. During the last months, we have made a lot of changes across the company to be able to manage this situation effectively. We have increased level of inventories in a few areas. We have signed long-term agreements with some key suppliers. We have redesigned our tools and processes. So we have made a lot of changes that are allowing us to manage this situation effectively.
So you don't think we're up against seeing laptop shortages anytime soon?
Well, we continue to see demand stronger than supply. But the fact that we were able to increase the guide for the rest of the year shows that we are confident in our ability to continue to deliver strong results for the foreseeable future.
What are you hearing from school districts? We're talking to a lot of executives. This is going to be a different back to school season, in large part because there was no back to school season last year. How does that impact a company like HP?
Well, what we have seen during the last quarters is very strong demand from the education side for PCs, and we continue this to happening. I think even if schools reopen, they have realized that with technology, education can be more effective. And we continue to see very strong demand on the education side, and we expect it to continue.
Perhaps you can break down how you were able to grow margins, operating margins in both segments. We talked to a lot of folks, and the costs of doing business are going through the roof. Logistics, labor, you name it. How are you able to grow margins?
Well, if you think about the situation we are facing where demand is not being able to be fulfilled by supply, this is creating a favorable pricing environment for us. We have reduced significantly the amount of promotions that we need to do during the quarter. So even if we are seeing cost increases, we are able to compensate that. And this is what is really driving the strength on the results from a margin perspective.
You know, I know you. I know HP is really, it's focused on gaming. For investors not familiar with the HP story, do you have any exposure to crypto?
We don't have any exposure to crypto. And what we are is very happy with the progress that we are making with our gaming business. It is growing even faster than our overall consumer business. So this tells you about the strength of that business. We also are expanding into peripherals for gaming. We are about to complete the acquisition of HyperX that we announced a quarter ago. So gaming is a growth story for us that we expect to continue in the future.
Do you think crypto is an area of opportunity for HP?
At this point, it's not one of the areas where we are focused. What we really see is that the changes in how people work, live, educate are creating a hybrid world. And this is really the focus for the company. How do we continue to deliver products, solutions, and services that will make our customers to really be successful in this new environment?
You know, you and I have talked throughout the pandemic, and it's safe to say that we are rounding the corner in the pandemic. And you've mentioned a hybrid work model. How does that model impact an HP 2, 3, 4, 5 years down the line?
We think that the pandemic has opened tremendous opportunities for us to continue to grow. When we think about the new ways of working, of learning, of getting access to healthcare, they are all opportunities for us to continue to grow. If you think about how companies will have to continue to enable their employees to work from home, even if only part of the time, how kids will do work or the homework using computers, using PCs, how we can connect in a secure way, printing at home with printing in the office, all of them are opportunities for us to create new products, new services. And if on top of that, you think about the changes happening in the supply chain space, where companies are looking for more flexible supply chains to produce locally, this is also opening opportunities for us in 3D printing, in industrial printing, all segments where we are starting to see growth again, that will be big drivers of growth for the company in the future.
That was HP CEO Enrique Lores upbeat on the back-to-school shopping season and the outlook for computers.
Well, football fans know him as Megatron, one of the greatest wide receivers to play the game, but former Detroit Lions player and now new Pro Football Hall of Famer Calvin Johnson has his eyes set on a new prize. He's launching a new cannabis product line with his former Lions teammate, Rob Sims. And Calvin joins us today, along with our very own Reggie Wade. Calvin, a lot of congratulations for you on the new launch, as well as newly elected Pro Football Hall of Famer. When you look at the landscape right now in cannabis, it's certainly gotten much more crowded and competitive as more and more states have legalized it. So how does your line separate itself from the rest of the pack?
Yeah, Michiganders, they love their craft everything, from their beer on to their cannabis. We view ourselves as a boutique cannabis. We call ourselves Primitiv because we believe in that cannabis was an original medicine, hence the name Primitiv. So we truly believe in highlighting the plant's healing powers, and that's what we're here to do, is to bring a level of professionalism to this industry, operating at an excellent level while giving solutions to our people.
Calvin, you're making the transition from the locker room to the boardroom. How hard of a transition has that been, and what lessons from the gridiron have you brought into this new business?
Yeah, there's definitely been ebbs and flows, definitely a learning curve, especially coming into a new industry where there's always, it's almost like a moving target trying to stay compliant. There's new rules that are made and you just have to be able to pivot. But taking from the field, there's a lot of traits that you gain from playing the game of football. And I think perseverance is one of them. You just got to hang in there, stay in there, knowing that there will be better days if we stay aligned with our goals.
As a Bears fan, Calvin, I know well that you really did that against us a lot of times. So it's painful to kind of remember those memories, but it's a great career. And it was one that even me didn't want to see it come to an end because, you've been pretty outspoken about why you retired a little bit earlier than people expected. Pain was obviously a big issue for you. And you've talked about how cannabis has helped in all of that. I mean, how do you look at maybe the league's issues around it still to this day? And I'm curious if you were able to use it when you were still a player, if you would have been able to last longer in the NFL.
That you were restricted from using the sound, but there's a moving target on when we got tested as an annual test, and you knew you're good until that next window came around. Nowadays it is, I believe, good for the players that they have laxed the rules a little bit and allowed them to, maybe consume and heal their body in an alternative way than, the opioids, and we know with all the destruction that does. It's just about creating alternative ways, holistic ways that players can treat themselves. And yeah, for me, it was a holistic way that I approached my career, from the things I put into my body, from my supplements to the food I ate, and my medicine too.
So, Calvin, when you think about how the NFL policies have evolved, how much further do you think it has to go? I mean, you've seen, the league sort of up the THC I don't know if we call it requirements, but limits there. It feels like the thinking around the league has evolved, but you feel like it needs to go a little further.
I'm not going to say that. I'm happy that it changed for the guys what it did right now. I'm not exactly sure what the numbers are on the limits and everything like that, but I know that it has relaxed, and it'll continue to go. Probably not all the way until maybe the federal laws relax, but you never know. That could happen in the next decade as well. God willing.
Calvin, you were recently a part of a roundtable where you discussed not only the cannabis industry, but CTE and its effects on the NFL. How are what you're doing with this new company can help those affected with CTE?
Yeah, man, we've been blessed just through our partnerships. It started with, Tommy Shavers. He's down in Lake Nona, Florida. It's right outside of Orlando. And his company, known as Nestry, they're like a brain performance company. Imagine, the workout room before the brain, so that's what and awakening, what we thought were long and gone neurons in the brain. So they're the workout for the brain per se, and they connected us with Harvard. And since then, we've been able to join the consortium that is up there that we have with Harvard. It's a plethora of companies, Cannabis, and other like-minded individuals that are trying to look at plant matter or phytomedicine and create alternative ways for humans to create solutions for themselves and heal pain and CTE, as we were talking about. And like I say, our focus in that consortium is pain and CTE, two things that people deal with on a daily basis. Not two things, pain in general, people deal with on a daily basis. You, me, it doesn't have to be the athlete, each and every person. And then, like I say, as well as CTE, to try to create solutions for our brethren, not only NFL players, you have other sports athletes as well as veterans.
Yeah, there's a lot of arguments for the medicinal aspects, and we saw that kind of roll out across the states as more and more states legalized, given those rules. But you said you could see legalization here within the next decade. As a new entrant here, new business owner in the space, there's some people talking about maybe seeing it this year. I mean, what's your timeline for when you expect federal legalization to finally come through?
I've learned in this industry, once you put a timeline on something, it's not going to happen. Every time we put a timeline on, okay, we're going to get our license next week. No, we're going to get it like 2-3 weeks later. So I know not to put a timeline on those kind of things. It's not in my hands. All I can do is control, like I tell my team, control what we do, control our attitude, control our efforts and everything that we do. There are things that we cannot control, but for everything that we can, if we do those two things, it'll come out on top more times than not.
Calvin, what your former teammates and NFL alumni say about this new cannabis venture? They're down for it. What's been some of their thoughts?
Well, first and foremost, let me mention my partner and co-founder, Rob Sims. We came into this thing together. We started doing real estate, found cannabis real estate, and we thought, hey, man, we could put a team together, or we could just lease this out to a cannabis company. And we was like, hey, we've seen the good and the bad. We could put a team together, and this is where we are 3 years later. But could you hit me with your question one more time?
Yeah, I said your former teammates and NFL alumni, they've been in your corner with this?
Oh man, they come in town. They love to see the facility. I mean, everybody has great praises. They, I would love to invite you guys if you're ever out in Michigan. But everybody has seen our facility. They've say it's one of the best facilities they've seen. We're not an overly large facility. We're a commercial facility, but we're on the small side here in Michigan. But we're seeing a lot of growth right now and the recognition for our brand and that meeting quality.
Primitiv Group co-founder and Pro Football Hall of Famer Calvin Johnson, it's good to talk to you today. And our thanks to Reggie Wade as well for joining in on the conversation.
Welcome back. Well, there's new results from a survey on the employability of recent college graduates, and the results are just a little bit depressing. According to the results from Cengage, listen to this, more than half of graduates say that they will not apply to entry-level jobs because they do not feel that they have the skills. We're joined now by Michael Hansen, CEO of Cengage. So, Michael, we just had those numbers up on the screen. I'm curious to know if the reason so many of these college graduates don't want to apply to these entry-level jobs is a problem with the education that they received in college, or is it really a problem with the employers who make them feel that they're, not qualified for some of these positions?
Alexis, thanks for having me. And I think the answer is it's on both sides. First of all, the education system is not preparing the students with significant real life experiences and skills. And that leads them to feel inadequate when they apply for a job. In other words, the education system is basically looking for people to be degree ready, but not to be job ready. And on the other hand, as you pointed out, I think there is an overemphasis and almost a stigma on the part of employers that for every conceivable job, you need to have a degree. So I think both the education system and the employers need to change.
Okay, so having said that, that's a lot of ground to cover and a lot of, I think, changes that need to be made. Let's start with employers, because that's sort of our focus here at Yahoo Finance. What can they do to start to bring in more people at all different kinds of levels, and those who might not have enough work experience to be brought on to their organization in a big way?
Yeah, absolutely, Kristen. And let's start with a hard fact. 65% of the open jobs today require a college or an associate degree. And we did it. We are a large employer. We employ 4,500 people. We went through this and said, which of these jobs truly require a degree, or where often we're just basically doing it because we've always done it. And we found that you can actually weed out a lot of those requirements and open the jobs up for people who might not have a degree, but they might have a certificate. They might have a certain skill. They might have real life experiences that eminently qualify them. So that is a very simple step that every employer can take. And thankfully, employers are starting to do just that.
Michael, it's Kristen here. I actually think you got me and Alexis mixed up.
Sorry.
I don't know, too. No, don't worry about it. Alexis is a wonderful co-host, so I'm happy to be confused for her any day of the week. But I do want to ask.
Names, so my apologies.
I do want to ask you, though, speaking on that point, is a college degree really as valuable as folks try to make it seem? I think so many people talk about, how we have to have a college degree. But as you're mentioning, so many of these jobs could be opened up to folks even without a degree, but just perhaps with a certificate. So should we really stop de-emphasizing the need for a college education?
Yeah, I would say it is a question of for which job and for which career is a college degree really a good return on investment? And there are a number of jobs out there where that is clearly, the answer to that is clearly yes. But there is a large number of jobs where a college degree is not a good return on investment, where you got to say the average college degree costs about $30,000. And that's the average. For some, it's even a lot more than that. And the question really is, does that give me the skill set that's required for the career that I'm excited about, that I want to embark on, and I can continue to learn in that career as well. So it is the right horse for the right course, so to speak, to answer your question.
Are there particular kinds of jobs or sectors that would lend themselves to perhaps not having a 4-year degree or not having a degree at all that could still prove to be good long-term career choices for folks?
Absolutely. Absolutely, Alexis. And the two big areas are healthcare, number one, and the other area is works and jobs in IT. And we see a significant amount of increase in application to our business that gives those certificates. It's called Ed2Go. And that business has seen a 50% increase in demand, in particular in those two sectors, where people are saying, you know what, for $2,500, I can get a certificate that allows me to become, for instance, a medical coder and actually have a very good income and very good return on that investment. And guess what? It's going to take me 4 months as opposed to 2 years or 4 years.
Where do internships really fit into this whole equation? I hear you talking about those certificate courses, obviously college degrees, but what about internships? Should those that are in college really try to boost some of their skills by getting internships in order to apply for some of those jobs?
Absolutely, yes. And I would go even a step further. I think what we need to do, and what is thankfully starting to happen, is we need to mesh together the employer world with the education world. And I think it is happening right now, primarily with community colleges in local areas, where students can be in a course in the education system, but at the same time work in a company, do an internship in a company, and really figure out what it takes that I'm learning here theoretically in the school and in the college. How does it apply to the real world? And that meshing of the job skill requirements and the curriculum in individual colleges, that is what needs to happen. Thankfully, it's happening on the ground. It's happening here in New York. It's happening in other communities around the country. But this is the way forward, no doubt.
All right, Michael Hansen, CEO of Cengage, thanks so much for joining us with those insights. Welcome back. Some really positive news coming out from Annovis. Their phase 2 trial of an Alzheimer's treatment shows a reversal of the disease. We're joined now by Maria Macchiacchini, Annovis's CEO. So Maria, as I was just mentioning, I had been reading that, there was the reversal of Alzheimer's and other reports. It looked like a serious reversal towards baseline in patients with mild to moderate Alzheimer's. I'm just curious if you can just give us a brief readout on the results that you guys got. I know in the break you were mentioning that these results were even surprising to you.
Yes, thank you so much for having me. And I'm so proud to be here and be able to say that finally it looks like we may have something that gives hope to people. So yes, we only did a small study and it only lasted a month. And the best we would hope for is that maybe there wasn't that much of a difference or just a slight improvement. What we saw is a 30% improvement in cognition in Alzheimer's patients and in motor function in Parkinson's patients. So in both patient populations, we saw a 20 to 30% improvement in whatever we were measuring, one by UPDRS, which is the Parkinson's scale, and one by ADAS-Cog, which is the Alzheimer's scale.
It certainly is encouraging news in the fight against Alzheimer's. But for folks who don't follow the biotech industry closely, what is the next step here for this drug, and how long might it be before we really see it used, for the wider population?
Well, of course, the regulatory pathway is long, which is good because you do not want to give something to patients that doesn't work or could have negative effects. So this was a phase 2 study, a double phase 2, Alzheimer's and Parkinson's. And we haven't quite finished yet. We still have some patients to treat because we wanted to expand the number of patients we are treating. So it should be done, fully done in summer. And then we'll go to the FDA, we'll present the data, and we'll ask to go into phase 3. Phase 3 are much larger studies that last much longer. So more people, longer time, and then we should see full efficacy. If everything goes well, a study cannot really last much, it cannot be shorter than 2 to 3 years in Alzheimer's and Parkinson's because the decay is so slow and you want to prevent it and show that over time you have an improvement or no change. So I would think that with a lot of luck, we'll be on the market in 24.
Curious, Maria, because I think this past year has really changed a lot of folks' minds, at least when you go from research and development to a drug actually hitting the market, as we have the coronavirus vaccine essentially done in a year and now going already into people's arms. I hear what you're saying, that you think that this treatment might be more readily available by 2024. I'm curious to know if there was any differences because of the pandemic in terms of changing speed as you guys are moving forward in these studies and trials.
Well, I wish I could say yes. I would take the pandemic and use it. No, not really. But the reason is, what are you checking? If you give a vaccine, you're looking if the people are protected in the next few months. Right now, they're looking if they're protected after a year because the vaccine has been out for that long. In Alzheimer's and Parkinson's, you have to look what happens to the trajectory of the disease over time. Because what if it improves cognition in the first 3 months and then it drops it? So it is by definition a much slower study, and it really cannot be sped up too much. I mean, the best way to speed it up is add more people, which means it takes a little bit more money, but you have a faster readout. But I don't think we can have a decent readout under less than 1 year, no matter what we do.
Maria, you saw the market reaction to this positive news. It was pretty incredible to watch. Shares of Annovis jumping from $24 to $60 a share last week. And I know you had a previously announced $50 million public stock offering, which I believe just closed. So good timing there for Annovis. What are you going to do with the money raised from that stock sale?
We're going to do a lot of things because we were very virtual. So when you're virtual, you really don't have many people. You work with consultants mostly. So we're going to, increase our staffing. We need a medical doctor really badly for phase 3. But most and foremost, this money is going to be used to do one of the 2 phase 3 studies we want to do. So we want to do one in Alzheimer's, one in Parkinson's. The money will be enough for one of the 2 phase 3s. That to me is the most important part because I do want to bring this drug to the patients.
Looking beyond Alzheimer's, is there anything else right now that is receiving a bit of attention from Annovis, other diseases that perhaps you guys are interested in exploring treatment for?
We have a plethora of diseases we could attack because our drug is not specific for Alzheimer's. Our drug protects nerve cells from dying. And in sick nerve cells, it increases the information highway. So let me explain. When you do anything, the information has to go from your brain to the fingers and from the fingers back to the brain, or from your brain to the eyes or to your tongue, or whatever you do. Your brain has to know what you do and your body has to give the information back. When a cell gets sick, that information highway slows down, it gets sluggish. And our drug improves it. Now, long term, when a cell is sluggish for a long time, it eventually dies. And our drug prevents that because the cell doesn't get sluggish, it does not die. We have shown that in 7 different animal models, so I'm sure it works in animals. In humans, I have to do much longer term studies to be sure about that. But basically, what is really important is that our drug, long term, should stop the disease.
Just going back to the fundamentals of the company right now, you became a public company not long ago. Like many biopharma companies, you're not yet profitable. What is the cash burn rate look like at the company right now? And are you looking to raise any more money? I mean, I know you just closed this recent round, selling more stock to the public, but anything else you're considering in the short term?
Well, our cash burn is very bumpy depending on our clinical trials. So right now it's kind of low because the two phase twos are almost going towards the end, so they don't cost much anymore. Once we start phase 3, we expect the cash burn to really ramp up. But as I said, we have enough for 2 years and 1 clinical study. If or when we want to start the second clinical study, we have to raise some additional money. And we think that that may be a little bit more than 50 million, but that should get us through 2 clinical studies, yes.
All right, Maria Macchiachini, CEO of Annovis, thanks for the great work you're doing there, and enjoy the weekend.
President Biden has rolled out his budget, and it is the highest level of federal spending since the Second World War. Just how much? $6 trillion. Let's chat about this more with Ed Mills, Senior Washington Policy Analyst at Raymond James. Ed, great to have you with us. You know, we were talking about this just a little bit yesterday, but I would love to get your thoughts on the fiscal responsibility of a package as large as $6 trillion as President Biden is proposing.
Yeah, these are eye-popping numbers. It is adding the $1.5 trillion that he's proposing for both domestic discretionary as well as defense spending, including the $4 trillion that's there for the American Jobs Plan and the American Families Plan, in recognizing some of the out-year spending of the COVID relief bill that has already passed. It is honest to include the infrastructure spending in this bill, but I do think that it is going to set up a partisan battle in DC when you have numbers this large and you have bipartisan negotiations going on. I guess my thought here is that it is going to give more ammunition to Republicans to say these numbers are just too big. And ultimately, if there are going to be spending on some of these infrastructure priorities in this bill, it is more likely trending partisan when the top line number is this eye-popping.
Yeah, Ed, let's pull out that infrastructure package for a moment, because the Republicans came out with their counteroffer, $928 billion, I believe, versus the $1.7 trillion for Biden's plan, which actually is lower than his initial plan, which I believe was $2.3 trillion. Do you think this counteroffer gets us any closer to actually moving forward with the infrastructure package?
Alexis, great question. The way I've been looking at this and the way I've been telling clients here at Raymond James to think about it is, what does this do to the outcome rather than focus on the process? So I'd say there's 3 things that happens there. Now, I think the floor is at about $1 trillion. Some people thought the ceiling was $1 trillion. Number 2, Republicans in their counteroffer do not raise a single cent of taxes to spend that nearly $1 trillion. So the amount of spending that has bipartisan support without raising taxes is also about $1 trillion. Is that going to be deficit spending? Is that going to be more collection of taxes by the IRS? Is that going to be repurposing things like COVID aid? Those are political decisions. Third, always focus on the debt limit. Democrats are going to have to increase that at one point this year, and that's going to be done through reconciliation. So even if we get $1 trillion on a bipartisan basis, when we add in some of the other priorities like domestic manufacturing or the child tax credit, it easily gets to $2 to $3 trillion in my mind, and that continues to be the base case of what the final total spend will be this year.
So I'm curious to know how the political makeup right now of Congress, with Democrats having both control in the House and the Senate, really changes some of the calculations going forward with some of the support for this bill, both infrastructure, but also this $6 trillion budget bill.
Yeah, so they do have control, but they are extraordinarily slim margins. In the House, it probably doesn't get as much focus as it deserves. Ultimately, I don't think they are the ones that hang this up, but it's going to be very difficult to negotiate and ultimately pass a budget to set in motion the reconciliation instructions. In the Senate, you have individuals that we talk about all the time, Joe Manchin from West Virginia, Kyrsten Sinema from Arizona. They want a bipartisan process to play out. Part of me believes that's largely a political exercise. And I ultimately think we are going to go through that, establish some floors, establish some things that we're for, and then move to a partisan process to go through reconciliation. The only way you can exercise your full majority for Democrats is to do things like reconciliation. And that's why I see things heading down that path. Bipartisanship, unfortunately, just doesn't really exist in DC today.
No, pretty elusive still, Ed. Nothing new, sadly. Want to talk about how President Biden and his team plan to pay for most of that budget, and that is by raising taxes on wealthy individuals and corporations. He has not beaten around the bush about it. We're all expecting the capital gains tax to increase, but now he is proposing making that retroactive to April 2021. What's the likelihood that's really going to happen, Ed?
So the way I've been telling clients at Raymond James, and we get a lot of questions from our financial advisors in terms of advising their clients as well as the institutional clients I talk to, I think that there are three parts of this that are all intertwined. The rate on capital gains, the date of effectiveness, and then the elimination of step up in basis for transfers after death. The more that threshold that gets excluded from the kind of change to step up in basis, the more that rate comes from 39.6% maybe down to 28%, the higher the likelihood that Democrats are going to push hard for an effective date as soon as possible. They do not want to see the ability for folks that get impacted by this to have a window and have a market sell-off tied to it. So, it is a kind of balancing act. But the more that rate comes down, the more likely that rate is earlier than many investors would like to see.
So I guess I'm just going to ask you that question about a market sell-off. I mean, how are you guys anticipating equities are going to react to some of these proposals around raising taxes?
So I think that the kind of threat of kind of tax increases is certainly there for the market. But part of the outline I gave in terms of there's about $1 trillion worth of spending that can be supported without a single dollar increase in taxes says to me that the worst case scenario or the highest kind of dollar amount collected from tax increases is off the table. We also know that the top number in terms of what is going to pass seems to also be coming down. So this is what we've described as somewhat of a Goldilocks scenario where it is not too big or not too small. The market does want both that additional spending, but without tax increases that are going to fully pay for that. That's the kind of path that we're headed towards. So from a market perspective, we think this is actually okay.
All right, Ed Mills, Senior Washington Policy Analyst at Raymond James. Thanks so much for joining us today.
Welcome back to Yahoo Finance Live. I'm Julia LaRoche in for Shauna Smith today. Well, some pretty major news on the COVID-19 front in terms of fighting COVID-19. Vir Biotechnology received an emergency use authorization this week from the U.S. Food and Drug Administration for SotroVima. But we're joined now by George Scangos. He is the CEO and president of Vir Biotechnology. George, for our audience, what does this mean? What is this talk to us about, walk us through this treatment. What does this mean in the fight against COVID-19?
Well, short message is I think it's a really important day in the fight against COVID-19. We have an antibody drug that we have developed, brought through a phase 3 trial. The initial analysis of that showed that we had an 85% reduction in reducing hospitalization or death among patients who had taken it. So that's quite impressive number. COVID cases are going down in the U.S. now, but they're not going away. We're going to continue to need good therapies for the foreseeable future, and we're really quite excited about what we can do now for not only patients in the U.S. but around the world.
George, congratulations. Help us understand what the drug actually does. It's not an antiviral, or is it an antiviral, or does it prevent the
the issues that wind up making people seriously ill and then eventually perhaps dying?
No, it is an antiviral. The antibody recognizes the virus, it binds to the virus, and it does two things, actually, which distinguishes it from some of the other drugs that are on the market. First, it prevents the virus from infecting cells. And secondly, when people are already infected, there are a number of cells that are already infected, and they're making even more viral particles. So this particular antibody is capable of blocking the infection of new cells and killing those cells that are already infected with the virus to prevent making even more viral particles.
Mm-hmm. And George, you said something really important, that it resulted in an 85% reduction in all-cause hospitalizations or deaths. So as you were talking about COVID-19 globally, you got the emergency use authorization here. How about in other parts of the world? How are you deploying this treatment? What has that been like for you all? What are you seeing worldwide?
Yes, well, we have a what's called an Article 5 scientific assessment, a positive opinion on that from the EU, from the CHMP committee in Europe that does the assessment, and that opens up the door for individual countries in the EU to purchase the antibody. So it's not quite the equivalent of an EUA, but it's as close as Europe comes. So we hope to be able to make the antibody available both in the US and Europe very soon now. There are other parts of the world, India, for example, where there's a huge need for treatments. It's a tragic situation. I think tragic is an understatement. It's just devastating. And so we are working as quickly as we can to make the antibody available in India and other parts of the world that are being devastated by COVID at the moment.
And can you
that's not, it's solely an altruistic thing. I think we're not going to be free of COVID until the world is pretty much free of COVID.
So
you've seen how it travels.
Is it a pill? Is it like Regeneron, I think, is administered via IV? Is this a simpler way to administer this drug?
No, this is also intravenously administered, just like the other antibodies. We are quickly working on just a normal injection, intramuscular injection. So it would be similar to what you get with the vaccine or the flu shot. And that's in clinical trials right now, but the medicine for which we have the EUA is administered IV.
George, circling back to India, are you all able to deploy this treatment in India presently?
Not yet. We hope to be able to very soon. We are working as quickly as we can to make that available. We, of course, need regulatory approval from the Indian government. I think that getting the EUA in the US greatly facilitates that. And so, the EUAs only got issued Wednesday. And so very recent. And based on that, though, we are accelerating our interactions with governments around the world, India and other places as well.
The biotechnology that makes this an effective drug, does it have applications for viral issues other than COVID-19? Could you be growing this for other remedies?
Well, that's a very interesting question. This particular antibody, as opposed to all of the other COVID antibodies, is able to protect against other coronaviruses in addition to the COVID coronavirus, this coronavirus. Doesn't protect against all coronaviruses, but for example, it would protect against SARS, we believe, and a whole family of coronaviruses. So we do believe that it's important to bring forward drugs that can not only treat this pandemic, but have the potential to be effective in future pandemics. And we're taking that approach, not only COVID, but flu and other diseases as well. Yeah.
George Scangos, President and CEO of Vir Biotechnology. I thank you so much for joining us, and congratulations again on the latest as it relates to your treatment and this, of course, important fight against COVID-19.